Hi everyone, my name is Kimiya, and today I'm going to introduce you a little bit to what acute spinal cord injuries are, also known as SCIs. We'll also be looking at recent advancements in therapy options. So what is acute spinal cord injury? Well, it often occurs from incisions, contusions, or compulsions to the spinal cord. It typically results in either temporary or permanent disability and mortality in both adults and children. Evidence has established that acute spinal cord injury is actually a two-step process, which involves both primary and secondary mechanisms. Primary injury signifies the primary damage that occurs to the spinal cord. This is a result of distortion of the spine. This ultimately is directed damage to the neural elements and blood vessels from either a fractured or dislocated bone piece. In contrast, the secondary part involves a combination of biomedical cellular processes such as post-traumatic inflammatory reactions. The effects of the injury impact not only the physical nature of an individual, but also the overall quality of life, by affecting patients mentally and socially for the rest of their lives. A study which was conducted between 2016 and 2017 concluded that roughly 15,000 people in Australia suffer from spinal cord injury, with around 380 new cases arising each year. Of these cases, a whopping 80% were males in motor vehicle-related accidents. More than half of the total number were between the ages of 16 and 30 years, sitting at 227 cases. So what exactly causes SCIs? According to Spinal Cord Injuries Australia, motor vehicle accidents hold 39% of traumatic SCI cases in Australia. Following this, falls come second place, mostly occurring in the older population and holding 36% of the cases each year. Sport-related incidents and acts of violence such as gun wounds or stabbings are also quite prominent causes of this injury in today's society. There is a variation of symptoms that are associated primarily with the location of the injury along the spinal cord and the extent of damage caused. Symptoms include loss of bowel and bladder control, difficulty in breathing, and the overall loss of movement. The severity of an injury is recognized by the completeness, and is either identified as complete, which refers to losing all sensory and motor function below the spinal cord. However, an injury is recognized as incomplete when the patient still has some sensory and motor function below the impacted area. Moving on to treatments. SCIs require immediate attention at the site of the incident. This is essential as the head and neck must be immobilized in order to prevent any further damage. In some cases, surgery is required as a means to assess the injured spinal cord or to essentially stabilize any impacted bones. Regrettably, there is no way to undo damage caused to the spinal cord, and so patients are encouraged to return to an active lifestyle in order to maintain their mental well-being. However, researchers are aggressively looking for alternative treatments and medications that can encourage spinal cord regeneration. The implication of medications such as corticosteroids like methylprednisolone was considered as treatment for patients suffering from spinal cord injury. As it is a steroid treatment, it was deemed to be able to reduce the damage to the affected nerve cells and assist with swelling of the spinal cord. However, recent studies provided evidence of adverse side effects of gastrointestinal bleeding, which ultimately could lead to death. As a result, updated guidelines no longer approve this for patients. Other treatments include ICU, ventilators for breathing assistance as a result of chest muscle function loss, and a bladder catheter where a tube is placed within the bladder to drain urine where the patient has lost the function of the bladder. Current treatments for SCI are limited, but it was discovered that naloxone is an opiate receptor blocker, which assists in the spinal blood flow within patients suffering from SCIs. Studies concluded that naloxone is not efficient for recovering during acute spinal cord injury. Comparably, nipodamine is known as a calcium channel blocker which lowers blood pressure and enables the flow of calcium to slow down into the blood vessels. This essentially reduces the effects of injury-related ischemia. In conclusion, neither of these treatments showed any beneficial impacts on patients' recovery. As a consequence of this, modern research is being conducted in order to discover the most significant sources of therapy. After investigating the current therapy options for patients suffering from acute spinal cord injury, we can hope that future advancements will progress towards developing safe and effective treatments that can restore the loss of motor and sensory functions within impacted patients. Body weight sustainability gait training is an emerging approach to therapy which is currently being trialed. Evidence suggests its possible effectiveness is rooted from hypothetical existence of a central pattern within the lumbar spinal cord. Furthermore, studies working on addressing the effects of SCIs puts emphasis on preventing further tissue loss and replacing the cells that have diminished as a result of apoptosis. further producing axons and re-establishing synapses that encourages operative recovery. However, developing treatment strategies that are safe and efficient are limitations of future advancement. Concluding with today's topic, it is evident that acute spinal cord injury can be prevented, and that's through taking additional caution in regards to falls and motor vehicle accidents. And with existing trials looking for an effective and safe treatment to surface in the future for suffering patients, it gives us promising hope that patients will regain a significant portion of their quality of life once again. Thank you.